In 2010, CDC established the Center for Global Health, CGH, recognizing that our domestic and global work could not be separated and that no country can protect the health of its citizens in isolation from the rest of the world. CDC possesses unique expertise to address the challenges of global health, working with domestic and international partners to improve health and well-being worldwide. The job was massive, the mission clear. Protect people from health threats and improve health globally through science, policy, partnership, and evidence-based public health action. CGH facilitates global health collaborations by bringing in CDC's world-renowned expertise from across the agency and coordinates cross-cutting work in maternal and child health, refugee health, and water and sanitation. We provide leadership and management support to CDC staff around the world. They are the agency's visible face in partnering with countries to implement global health activities. We've seen many changes in global health in the last 10 years and embraced the importance of science and health diplomacy. We've learned that infectious diseases can move around the world in 36 hours or less, whether it's Ebola virus disease, polio, measles, influenza, or COVID-19. The Center for Global Health is science-based and evidence-driven. Through our CDC core strengths, subject matter expertise, state-of-the-art laboratories, effective use of data, and a high capacity to surge our efforts, we support the U.S. President's Emergency Plan for AIDS Relief, PEPFAR. As of 2019, nearly 16 million people living with HIV were receiving treatment through PEPFAR. And CDC was supporting more than 1/3 of all people on treatment globally, accelerating progress towards HIV epidemic control. CDC is on the front lines in the fight against TB, supporting the highest burden countries to find, cure, and prevent TB, which remains the world's deadliest infectious disease killer. Under the U.S. President's Malaria Initiative, CGH's scientific support has contributed greatly to the prevention of 7 million deaths and 1 billion cases of malaria. Our expertise in the science of eradication has brought us a long way towards ridding the world of polio. Since the Eradication Initiative began in 1988, the number of polio cases has decreased from more than 350,000 per year to 156 in 2019. Our global measles experts have contributed to a 73% reduction in death from measles, saving more than 23 million lives since 2000. Communities around the world are no longer at risk for diseases like lymphatic filariasis or leishmaniasis, and because of our efforts, guinea worm disease is on the road to eradication, with less than 30 cases reported in 2018. CDC's Global Rapid Response Team is at the ready. Due to decades of CDC expertise in infectious disease outbreak response, CGH and CDC are prepared to rapidly surge and effectively respond to infectious disease outbreaks around the world. The Field Epidemiology Training Program is one of our flagship capacity building initiatives. Since 1980, CDC has helped train more than 16,000 disease detectives in over 70 countries, ensuring that they can rapidly respond to public health outbreaks like COVID-19, natural disasters, and humanitarian emergencies. CGH is effective because of our people, scientists, public health professionals, and communications and policy experts, and many others. I am incredibly proud of our diverse, nearly 3,000 person strong workforce in Atlanta and in countries around the world. Together, we've made incredible contributions in global health over the past 10 years, but there is much more to do. As we look ahead, we must sharpen our strengths in science and service to lead bold goals, so that we can continue to maximize our impact on the health of people in the U.S. and around the world. The Center for Global Health pledges that our workforce is resilient, relevant, and ready to take on the public health threats of the next 10 years and beyond.